24 minutes before 10 o'clock. Thank you for tuning in. Everybody's very excited about this soccer game today. Is it in Germany? Is that where the game actually is taking place? I don't even know where it's taking place.
I don't know where the event is being held. I wish I did.
And,
seems exciting.
And soccer is, it's arguable, but it's here. I mean, we have kids playing soccer in the schools. Last year, there was a story out of New Jersey. There was a school district in New Jersey that required the students who were playing soccer to wear helmets. And it was kind of an interesting-looking helmet. It wasn't like what you picture with the football helmets. It wasn't like a whole head thing, but it was protecting the head some way. And I don't remember exactly the science behind it. But what I do remember was the question, are we wussifying our children? We're wussifying America. And I thought, you know what? Don't you hate that? When you realize, look, my child is going to be better off wearing something, you can call it whatever you want, but you're not going to make my child feel like he's a wuss or some other whatever word you want to put in there.
Yeah.
Make him feel ashamed or embarrassed or whatever, so that you can have your whatever you get out of that, and then he ends up with a brain injury.
Exactly.
Right? I'll just never understand that kind of bullying. Our next guest, if I went to the beach with him, I would keep my shirt on because there's no way I could outdo this guy. He's got the physique every man wishes he could have.
He's healthy.
I am not gay, by the way, but
No, you are not.
This guy's got a good physique. Dr. Brett Osborn is on the phone. He's also on the cover of his book. I would be too if I had that body. Dr. Osborn is a board-certified neurological surgeon, a diplomat with the American Board of Neurological Surgery and the American Academy of Anti-Aging Medicine.
Yeah.
Really? There's such a thing, huh? The book is called Get Serious, a neurosurgeon's guide to optimal health and fitness for men and women of all ages. The book, by the way, I want to make sure we're fair to the book, but I think also part of our discussion this morning is protecting our heads, protecting the heads of our children. And I believe part of this does have to do with the soccer helmets, I think. I might be wrong about that. Let's find out. And the bicycle helmets, too.
Yeah.
I mean anything. I mean, why would you make somebody feel bad by trying to do something that's the right thing?
Sure. And the book is wonderful, by the way.
The book is really well done.
Written.
Yes.
Yes.
Lots of pictures. Yeah. I could use more pictures of women, but
that's okay.
Dr. Brett Osborn. Good morning, Doctor.
Good morning. Thank you for having me.
Oh, you're welcome. I hope I didn't embarrass you too much.
No.
If we go to the beach, you'll pay me back.
Exactly.
I'll be the one embarrassed. Yeah. Well, where are you?
My shirt on. I'm in West Palm Beach. West Palm Beach.
West Palm Beach. Do you know John Bastow?
I don't.
He's a fitness guy up in New York. He lifts his shirt and lets women rub his abs.
Yes, he does.
You don't do that. You don't do that, do you?
Well.
Oh, you do. You do. Hey, can I rub your abs? Do you get that a lot? Is it like the pregnant woman? Hey, can I feel the baby?
No, intermittently the nurse just come around and just sort of just do it, So there's no questions asked.
That's right.
So have you always been physically fit? I mean, is this something you?
I have, and the book is based upon about, or it's accumulated from or over the past 30 years of exercise experience, nutritional experience, and more recently my experience with hormone optimization in the context of health and longevity.
And hormones derived from what? The hormone? I'm always confused about hormone therapy because you hear so many conflicting stories. Like there are natural sources of hormones, and for the listeners who say, "Oh, this is going to be an infomercial," it's not. I'm just asking.
Right, not at all. I'm not here to sell anything. As a matter of fact, hormones that I am an advocate of and hormones that I use in my practice are what are called bioidentical compounded hormones. Not any of the stuff that has been given the bad rap, such as the hormones that are utilized in the WHI study, the Women's Health Initiative study, which really vilified hormone replacement for women, but in actuality, bioidentical hormone replacement in women is perfectly safe in the right population of patients. And more recently, as you're well aware of, JAMA had a large article on testosterone therapy. That study has a myriad of flaws in testosterone therapy in, again, the select patient population, hypogonadal men with
hypergonadal men? Wait. Let me ask you about that. What is a hypergonadal man?
In other words, it typically occurs in men that are over the age of 35 and they feel fatigued and they're unable to put on muscle and they have depressive type of affect, which is typically what occurs to most men as we get older. And that is
so that's a bad thing. To be hypergonadal is bad.
That's correct.
Oh man, I was going to put that on my business card.
Low sex drive, lack of erectile dysfunction, poor libido, all of the things that men experience as we age, basically. Those individuals are potential candidates for testosterone replacement therapy. And I'm not going to go into why the studies were flawed, but there are numerous reasons why they are. And I want to make it very, very clear that men that are considering testosterone therapy seek the advice of a boarded anti-aging physician and get on testosterone therapy if deemed an appropriate candidate.
Okay.
Okay.
But does it increase sex drive? Does it decrease the size of your testicles? We heard so many different things about.
Yeah.
Right? Didn't you hear that? Wasn't there a guy on here said if you're taking testosterone, then basically you
Yeah.
I almost said the B word. Your male things.
Right.
Yes.
Right.
They're not. They're going to feel unnecessary and they're going to kind of shrivel up. Is that right?
They can in a percentage of patients. There is what's called testicular atrophy, but if that's a concern, the cosmesis, somebody looking at you, well, then that's certainly a consideration. Although it does not happen in everybody that's on testosterone, I can tell you that for sure. It's actually a small percentage, but nevertheless, it does occur.
Does happen, yeah.
But it can, and in the context of the benefits, I think that the benefits far outweigh the risks.
Yeah.
And this is not something where you're a professional bodybuilder where you're going to be using this in a cyclical manner. This is something that you're on forever in order to improve the quality of your life.
Okay. Can I focus? I'm going to make sure that I'm fair to your intent of being on the air with us today. Obviously, the book is well done, and I want the listeners to know about the book.
Yes.
But it looks like from the notes that we got from Rich Gazarian, your publicist, it sounds like we are being directed to talk about the concussion prevention. Am I right about that, or is that just?
I will talk about whatever you'd like me to talk about.
Okay. Well then let's do this.
Absolutely.
All right. Let's talk about that just enough. Because here's why. Obviously, soccer is a game that's already popular, and it's probably going to become more popular, especially after today when we win. Sorry.
That's right.
But does a soccer player get? Well, how do I ask this question? Is there any danger in a soccer player using his head to hit the ball? I know head against head is going to be bad, but when you have some of those players, they'll actually hit with their head. Does that alone cause problems? Right,
and that's a very, very good question, and you already answered the question.
Did I?
Yes, you did. The danger in heading is associated with the small danger in heading is associated with head-on-head contact. Okay, of course it is. Of course it's dangerous. Playing rugby is dangerous for a similar reason. I mean, there's a lot of there's potential for head-on-head contact, but the data suggests that heading the soccer ball unto itself, utilizing proper heading techniques, is not associated with an increased incidence of concussion. No.
Okay. And now last year, the article I was talking about from the New Jersey mandate for the soccer players in that one school district, when that article came out, the helmets almost looked like, what did they look like? They almost look like not sailor caps without a brim, if that makes sense.
Right. And to tell you the truth, I don't think that it's ever going to be something that sticks because, as I had said before, I think that the issue of heading the ball, as long as you're heading the ball properly, I think that the incidence of concussion is quite low. That's what the data suggests. And as far as the direct head-on-head impact, unless we're formally helmeting our players, which is not going to be done, and I'm talking about with big, with large helmets such as the what are worn in the NFL.
Right.
I don't think that you're really going to significantly impact the incidence of the small incidence of concussions that is already occurring by virtue of the head-on-head impact. I just don't think that it's going to take off. I really don't.
Okay. So I wanted to make sure we got that out of the way. I actually got the feeling in looking at the material that was sent to us that the book is the bigger portion of today's discussion. I mean, you've covered a lot of ground in this book, and it is for men and women as well. So who would pick up this book? Is it the person who's already on the way to being healthy, or could the couch potato change his life completely with the information in your book?
Right. The book actually, as it says on the cover, it's really for men and women of all ages. That includes somebody from ages 15 to age 90, because there's something in it for everyone. I oftentimes have patients in my office. I do a lot of spine surgery as a neurosurgeon by virtue of the referral patterns, and I have patients who come to me and they're 80 years old and they have back pain, and I look them square in the eye and tell them square in the eyes and say, you need to exercise. And they say, well, what does that mean? I say, well, it just doesn't include walking. It actually means going to the gym and getting a trainer, unless you have knowledge already, and start lifting weights. And they look at me, what? Lift weights? I can't do that. I'm 80 years old. Why not? What in your physiology suggests that you can't lift weights?
Mm-hmm.
The best thing you can possibly do for your musculoskeletal system, particularly in women, because they're at risk for fractures, hip fractures, osteoporosis. And once you have a hip fracture, the chances of you actually getting out of the hospital with a hip fracture as an older individual, you don't have good odds. Let's put it that way.
Okay, so now just to ask, I guess, a follow-up question to what you just said. All gyms don't have weightlifting programs. A lot of gyms are all about like the Pilates or something. There's no weights there. There's no weights in many of them. So, but you're specifically saying weightlifting or resistance training or something like that, right?
That is correct. Absolutely. There are substitutes. Okay, but if I had my druthers, it would be absolutely utilizing weight. There are plenty of good body weight exercises. If you have the exercise knowledge to perform these, but if at all possible, my recommendation would be to use weights.
Staying healthy takes a lot of work for people to do that, and they have to be motivated in the very beginning, because once they get into the routine, then it'll seem like a breeze. But how do you manage to get them motivated?
And that's a very, very good question, and it's something that is done through a lot of counseling, quite frankly, in my office. I don't have one specific method that I use. But I assess what's important to that individual in their lives. And a lot of people say, well, that they have grandchildren that they want to stay fit and healthy for and see them graduate high school, college. And I try to turn that into some sort of motivation or some impetus for them to stay healthy and exceed the average life expectancy of an American, which, by the way, is a deplorable 78 years. We should be, in the context of what is said in that book, incorporating nutritional strategies, daily exercise, stress reduction techniques, getting your hormones optimized. We potentially could be, by virtue of the fact that we're thwarting age-related disease and minimizing risk factors such as diabetes, hypertension, through those various modalities, we potentially could and should be living to 100. Why shouldn't we?
Really? Oh, wow.
Absolutely. Absolutely.
I want you to talk about diet a bit. I know you do in the book, and one of the things you address is cholesterol and how we are getting the wrong message, and maybe you can even explain why we're getting the wrong message.
Right. Historically, we've been fixated on the fact that patients that have elevated cholesterol are at increased risk for coronary artery disease, et cetera, et cetera. But and I do talk about this in the book. The majority of patients that undergo bypass surgery, coronary artery bypass surgery, they have normal cholesterol. Normal. So it's not so much the cholesterol that is the phenomenon or the entity that is hurting us. Cholesterol is a reparative molecule. So it basically serves to patch up problems that are occurring in the blood vessel lining. Okay, so I call it the epiphenomenon. There's something more sinister going on that is causing an elevation in cholesterol. What's more sinister? Well, and I talk heavily about this in the book, bodily inflammation. Inflammation, the inflammatory response, is the underpinning of diseases such as Alzheimer's disease, Parkinson's disease, cancer, diabetes. Hypertension is an inflammatory disease. Almost every single disease out there.
So what
diseases that kill us, okay, have an inflammatory component to them.
And what is causing us to become inflamed?
Poor choices, lack of exercise, poor nutrition. So, inflammatory fats, which are discussed in the book, okay, omega-6 fatty acids are pro-inflammatory.
And where do they come from? Where does the sixes come from?
Potato chips.
Potato chips.
You got it. French fries.
So if we think we're bad, if we think they're bad, we're probably right.
That's exactly right, and they're the reason why they're quote unquote bad, and that's exactly what you say is exactly what it is. If you think it's bad, the reason why you think it's bad is not because it makes us fat. Well, it does make us fat, but also because it's riddled, okay, with inflammatory fat. And it's not just the fat that is bad for you. You have to understand, in other words, we put body fat on, but we used to think that fat was just this storage depot for, well, fat and excess sugar that was converted to fat. That's not the case. Carrying fat around in your body is because it secretes inflammatory chemicals. It's like a gland. The fat is like a gland. And we're just now coming to realize that if you have a lot of fat, you are inflamed, and obesity unto itself, therefore, is a risk factor for age-related disease. Again, Alzheimer's, cancer, diabetes, hypertension, and the things that kill us. Does this make sense?
Yeah, but again, I'm looking for a simpler way to understand this. If I go to the store and I buy my food, do I buy the things that are natural, like they grew in the ground or they grazed from the ground, as opposed to they were manufactured in some machine in Battle Creek?
Yeah.
Absolutely. In addition to the fact that these synthetic foods have a lot of inflammatory fats in them, they also have estrogen-like molecules within them that are particularly bad for both men and women in the context of cancer. Estrogen is a growth hormone, if you will, and these estrogen-like substances that are in pesticides, etc., and in a whole host of other foods, they accumulate within the body, particularly in the fat, okay, and they act as growth-like factors for various cancers.
Can I back up a little bit to the cholesterol? I want to tell you something. Robin and I donate blood regularly. When we donate blood, usually within a week or so, do they send an email now or a paper mail?
Email.
But they send you a report, and the report will tell you what your cholesterol is, and then they'll give you a little guide. This is good, this is bad. Robin is always way higher than me. And let me tell you something. I don't eat as good as she does. Robin eats better than I do. As far as healthy choices, I'm the guy who you'll catch eating a box of, what do you call it, a sleeve of Pringles.
Yeah.
Yeah. I'm just letting you know that I'm putting the bad things in, but yet my cholesterol is always better than hers.
His is perfect.
Right.
Yeah.
Right.
What's going on there?
Okay, and that's a great question. You need to understand that your cholesterol profile, okay, the cholesterol numbers, okay, are heavily dictated by genes. Okay, we see that all the time.
You got to change your pants around. That's what it is.
I know, that's
it's
it.
It's the genes.
Get rid of those Levi's.
Okay, so the majority of the cholesterol that's in our blood, okay, that is a factor of not what we eat. Okay, so you eat a food that has quote unquote a lot of cholesterol. Is your cholesterol necessarily going to go up? And it's going to be no. And the answer is absolutely no. I want you to pay more attention to a couple of things. I want you to pay attention to your HDL, which is your good cholesterol, in the context of what your triglycerides are. And your triglycerides are a function of, if you're eating a lot of garbage, the garbage that you're eating, particularly the sugars. And I want you to pay attention to that when you get your profile.
One of the challenges we have in doing a radio show, especially with a book that has so much information, is that from our listeners' perspective, they're not really getting a good thumbnail sketch because there is no way to do a thumbnail sketch of this book. This book covers a lot.
It's wonderful.
So I want you to know, as listeners, because you're not looking at the book and I am, the book is called Get Serious, and Dr. Brett Osborn wrote it. And basically, I mean, it looks like to me, and I do have a question for you. It's almost like a personal question, but
Sure.
well, look
No
at that
problem.
dog. What's that dog's name? Oh, wow, that dog.
That's Neela.
What?
Neela.
Neela. Neela.
Neela. I
Yes.
bet you Neela's.
Indian for blue. She used to have very, very, very light blue eyes, as a lot of the.
Oh, really? Was she like a
Beautiful
pit,
blue eyes.
is that a pit bull?
It's a bit.
Oh, wow. Well, anyway, you giving an outline and the guidance actually for any of us to become healthier and look better. So the personal question is this, and maybe you can apply it to some of your patients as well as to yourself. And maybe you have a patient who really went one extreme to the other, the bad to the good, in other words. You look better. Do you feel better as well?
100%. I told somebody yesterday via Facebook, by virtue of what I've done, and of course, this has not been this rapid transformation for me. I was never one of these guys who was fat and unhealthy and then turned into what you see.
Right.
But I will tell you that in the context of regular exercise, stress reduction techniques, utilization of stress reduction techniques, proper nutrition, and hormonal optimization, I tell people that I am better, stronger, smarter, and faster than I was at age 16. And I will tell you that is 100% correct, and it's not an exaggeration at all.
And how old are you now?
44.
I just liked your Facebook page, by the way. I just found you on here.
Oh, thank you.
You have now 441 likes.
Thank you.
All right. Yeah, I found Dr. Brett Osborn on Facebook. If you want to like his page, then go ahead. You'll be 442. And I have a copy of Get Serious. This is really a great book. And if you just guys, you want to look like this, when you see a guy who looks like this, he can tell you how to look like this. Right?
Inside and out, though.
That's exactly right.
Because
Exactly right.
even if you look good on the outside, you might not be good on the inside. So Dr. Osborn really helps you do both things.
And we had one of the winners of the what do you call the fattest
Biggest Loser.
Biggest Loser. We had the Biggest Loser, one of those guys on, and I said to him, look, no women are listening right now. It's just between you and me. Are you getting more women now than you did then? And this guy really got into shape. I mean, it wasn't just about diet. He's doing everything you're talking about. So he's kind of following you. He said he's got so many more women now. So this whole idea that women don't care about looks is absolutely untrue.
Right. I think you're right. But let me also stress something else. It's not just about men. It's everyone. It's the same applies. Okay, physiologically we are nearly identical. Yes, women have estrogen and progesterone, but if those hormones are balanced as well, in conjunction with testosterone, yes, women can and should be on testosterone if they're deemed appropriate candidates for it by their physician. Women have got to get their hormones optimized as well, particularly in the context of their bone density. Very, very, very
all right.
Important.
And frail. Okay, so
we're up against Doctor. We're up against the clock. Let me give out the book. If you want the copy that I was sent, go ahead and call me right now, 622-WOCA. And Dr. Osborn, what's your website?
www.drbrettosborn.com.
BRETTOSBORN. No E at the end of his name and no U in there either. Dr. Osborn, thank you so much. Great interview and good luck. Come back.
Thanks so much for having me. I appreciate it. You guys have a great day.
And we'll be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.